Now, Dr. Moore, I want to touch upon pain because pain is truly a limiting factor for probably many people before they even decide to do the surgery. But right after surgery, what type of pain should they expect? Like, what's normal?
Yeah, normal pain is pain that you have that's consistent. It can be constant in the sense that it's there and you notice it, but it should be what they should expect is it should be covered by the pain medication that we provide.
Okay.
If the pain medication we provide doesn't cover it, that would be something that's a little bit more abnormal. Many patients are able to do this procedure and get appropriate pain relief with an anti-inflammatory medication that we give that's a once a day anti-inflammatory medication. So kind of like a stronger ibuprofen,
Mhm.
but it's prescription strength. And then Tylenol arthritis, which is like a higher dose Tylenol than the standard dose. And between those two, you can get a baseline amount of pain relief. And then we give a narcotic pain medication, but I only give about 7 day supply. Now, this 7 day supply of narcotic medication is typically used as needed.
But what about those that have like excruciating pain many weeks after the surgery? Should that be a concern?
Absolutely. I mean, I think there should be just some discussion with your doctor if you're still having significant pain after your surgery, to the point that the medication that we'd provided isn't covering it for you. And it could be for various reasons. Some instances, it could be from an underlying infection that might be there. Or some instances, it could be from scar tissue that's starting to overcome and to form faster than you can work to clear the range of motion that you need to clear. It could be for various reasons. So it should be something that should be reevaluated if there's still a significant amount of pain, weeks after surgery.
Okay. So would you say that it's something very urgent that you should get in and see as soon as possible?
Yeah, I tell everybody, listen, I'm happy to see you at any point if things are not what they should be, if things are out of the ordinary or unexpected.
Now, you said that at least by 6 weeks, a good majority are doing pretty well. But what about those patients that they are doing well, but they still experience pain, discomfort, say in their sleep? When should they experience like minimal to no pain eventually?
I would say 80% of patients following a knee replacement have complete pain relief. And it doesn't come right away, but it typically comes within the first six weeks, 3 months, sometime in that time frame.
Okay.
There's a small subset of patients, about 15%, that still have some residual soreness and pain that can proceed, and it can vary. It can come and go. It can be some sort like some low-lying aching that can be persistent, that can persist, quite honestly, for up to a year.
Mhm.
And then oftentimes at that 1 year mark, as the entire healing process is completed, then many of those individuals actually convert into a pain-free knee. And then there's the smaller subset of those 15% that will, for some unexplained reason, have some residual soreness and pain in their knee. And oftentimes I tell patients, hey, listen, we need to do some investigation. If there's something we can do and this pain is coming from a different source, let's figure it out. If it's not, then, we have to talk about other alternatives.